welcome to the Fit and Healthy Today show. And today our topic matter is going to be tendonitis. It came in by droves last week, and so I thought, you know what? God's telling me something, so I kind of thought we better focus on this issue since a ton of people seem to be having it. Best defined, it can be an acute or a chronic condition. Now, acute usually happens with just a sudden movement, or playing basketball with the guys and you haven't warmed up. Just something where you're working out, moving boxes, something, all of a sudden you can get what is an inflammatory condition of a tendon. And the most common areas where it occurs is the Achilles, which is the back of the ankle, the biceps, the front of the shoulder and arm, oh man, we're going to love it, the thumb portion. I'm not even going to get into the technical terms of that, but there's a tendon and ligaments that run along the thumb. The upper patella, which is the knee, okay, up above here. We'll get it all around here. We got a series of tendons and ligaments around there. Your posterior tibial, which is inside of your foot, which we oftentimes call plantar fasciitis. And then your rotator cuff, which is in your shoulder. Chronic conditions occur when you get a calcium salt deposit within that tendon ligament area, and those calcium salts literally slice and dice. You get inflamed, it gets swollen, it gets worse. It just doesn't seem to go away, and it can be actually very, very painful, particularly if you're on your feet and you got plantar fasciitis or you're doing anything with your shoulders whatsoever. And since it does tend to occur in areas where you move a lot, because your tendons and ligaments are where you move a lot, you're going to feel pain whenever you move those particular areas. So we've got the sudden or excessive tension on a tendon as being the cause. Repeated traumas. So we'll get ball players who are throwing the balls, and if they don't have the correct form particularly, or they don't snap it right, or they're snapping their shoulder, or with the knees, if you're hiking, you twist it, you turn it just wrong. Or if you're like my UPS driver, you're in and out of the truck all day long and you're stomping down on that area and it's not properly warmed up or stressed, or chronic trauma all the time to that particular area, and you'll get plantar fasciitis on the foot. There can also be, obviously, because you're born with it. How's that? Grooves in which the tendons are just more readily susceptible to tendonitis. It's just how your tendons and ligaments and your bones are connected up to each other. It'll tend to cause inflammation. And that's why you'll see oftentimes heredity-wise that families will have the same kind of conditions with their knees or that type of thing. They have a propensity towards tendonitis or those types of things because their anatomical parts of their body are just more prone. When we're talking about tendonitis, we're usually talking about an initial injury of a strain. And I see more improper treatments of strain, and I was a professional trainer for a lot of years, and I got to tell you, I wouldn't see the proper procedure. So I thought, for the sake of the coaches and for people out there who have an injury, that I probably should go through this so that you have some idea how you should treat, particularly when you just have an acute. That way we can keep it from becoming a chronic. So here we go. You got to rest the area, and I see more times coaches putting their players back out again when they've got acute strains. You got to rest it, okay? You don't put them back out on the field, especially when they're young, and then we're going to end up with a chronic issue that's going to follow them when they get to be in my age category. If you're an athlete, you want to remain an athlete, you need to rest it. You got to ice the area of pain to decrease the swelling for 30 minutes, and you put it on there not too tight. I've seen people snug it on and it cuts off the circulation. So for about 30 minutes with the towel underneath it, you don't put an ice pack directly on a wound, or I should say on a sprain or a strain. You're going to use a towel underneath it, you're going to apply it, and then you're going to put it on there, maybe with, you can do an ace bandage, but not too tight. For about 30 minutes, you take it off, you let it rest for 15 minutes to get the circulation, and you alternate it back and forth, if you can, as much as you possibly can within the first few hours of the injury. You're going to elevate the area above the heart. So if it's a shoulder, obviously you're going to, not too much of an issue. If it's in the knee area, or if it's in the Achilles area, which we see a lot with football playing, you're going to elevate it above the heart. You want to get the blood supply away from that as quick as you can, because the key for preventing chronic tendonitis is to reduce the inflammation, the inflammatory response, and then which allows the body then in turn to deal with it in a much faster fashion as far as healing is concerned. Now, if you have extreme severe pain, I mean, hey, you know, we all know probably where that's at. Or if you've got a situation where you've got it in the joint, you've got a loss of movement or function in it. I mean, a strain or a sprain, you can still kind of move it. It hurts a little bit. But if you got a lot of loss of function in there, you better be hitting that emergency room and going in and seeing the doc, because you could have, you know, completely torn tendons, lots of other issues, or maybe, you know, other broken bones, that type of thing that you may not be detected. So the level of pain as well as the inability to remove, or if it persists. So remember, an acute situation only lasts for a few days to maybe a couple weeks, that's it. But if it's an acute situation where it's becoming a chronic situation, or an acute that turns into a chronic situation, then you need to go to your doc, okay? Particularly if it's lasting for more than 2 weeks. Most of this is brought on, as I mentioned, by the sudden, and in most athletes, it's oftentimes, and hard to read the exercise, by not properly warming up and stretching. Now, I'll see players get out there, and I cringe because the coaches have got them out there, and they're stretching. And these young men and women aren't even warmed up. Their bodies aren't warmed up at all. So please, before you start stretching for prevention of issues with tendons, you've got to warm up the body. So whether it's wind sprints, you know, you're on the treadmill, whatever it is, or seriously, if you're out and you know you're going to be lifting a lot of boxes, I would seriously do some, you know, a little bit of jumping jacks, warm the body up, whatever it is, to get the blood supply, get it moving. So, because when tendons are cold, they snap, they tear, they rip. We've got to get them warmed up, and then we can stretch them very mildly and gentle. We're not talking about extreme amounts of stretches where I've seen coaches go like that. Please, that's not necessary. Just good, mild stretching just to get things moving and going. We don't need to do any extreme stretching. Save that for the ballerinas, not for the football players. Supplement-wise, man, there's a lot of things that we can do to prevent, and I think a lot of times, in addition to the sudden trauma types of injuries, it has to do with nutrient deficiencies. And I didn't write much as far as diet is concerned, because basically we've already so many issues as far as doing lots of fruits and vegetables, keep your protein levels up, watch your sugars, alkali your blood. Obviously those are all things that an athlete should be doing, and if you're doing physical activity, you should be aware of those, and that's a nutritional talk for another day. But supplement-wise, if you're an athlete, as far as supports of your tendons and ligaments, please, a good multiple vitamin that has lots of B's. And I'm not talking about your standard warehouse one with a 4 to 5% absorption rate. I'm talking about a good multiple that has maybe a B50 in there, a B100. Something that will give you substantial support, because those B's, in combination with mineral ascorbate C's and bioflavonoids, help prevent the injuries. Because remember, and we've got it down in here, deficiencies associated with defective formation and maintenance of collagen needed for tendon tissue. So, if you got the standard borderline scurvy, which I think a good portion of our population now has, because in order to maintain even basic health, you got to have 500 milligrams of vitamin C, and you're lucky if an orange has 25 milligrams. So when I hear a docs say, you can get everything from your food, that doc should have been put up and set down 75 years ago where he would be correct. Because a tomato or fruit back then would have had adequate amounts of C's. Nowadays, it is not the case. I can't tell you the number of people that I walk in the door that I'm like, you know, I'm seeing symptoms here of scurvy. You may want to check with your doctor and get tested for scurvy, which is obviously a vitamin C deficiency. And that's if people are even barely eating a couple of pieces of fruit a day. So remember, 60 milligrams to keep from getting scurvy, but the National Institute of Health says we need at least 500 to maintain health. Now, if you're an athlete, you're going to require a lot more because you have continual strains on those connective tissues and tendons. So you're going to require a lot more Cs and bioflavonoids. And there is truly, truly good double-blind placebo studies on this. For example, bioflavonoids showed 1/2 the time of recovery for sports injuries. I think that's absolutely paramount to recognize that if you're taking vitamin C, 2,000 milligrams twice a day, or even 1,000 milligrams twice a day with 500 milligrams of bioflavonoids, it's going to go a long way to speed your healing. I kind of tweaked my back last week. No more tweaking my back. It's done, gone, taken care of. It goes away fast. I heal quicker. I think keeping this in there. Now, there's a lot of stink about taking extra vitamin A, and they say, okay, it prevents the liver from detoxifying, all that wonderful stuff. There is some studies to back that up, and if you are pregnant, you do not want to do excessive amounts of vitamin A. But you do have to have at least 10,000 IUs of vitamin A in order to synthesize your collagen and for wound healing. For skin, acne, now you see all these people with acne scars. The C and the vitamin A is really necessary for collagen synthesis. So, and if you feel uncomfortable about that, we can throw in the natural beta carotene, as long as you're not a Northern European, extremely white person, because under those circumstances, you're not going to convert beta carotene really readily, because the genetics from that were primarily from fish and fish oils, where regular vitamin A is usually synthesized from. So, vitamin A, and most good multiples do have some vitamin A in there, so look for those that tend to have about 7,500 to 10,000 IUs. There was a lot of good studies on B12, most of them on injectables or sublinguals, that it literally slowed calcium deposits from forming. Remember how I told you that in a chronic issue, those calcium crystals would form in the tendons and just kind of freeze it up, hence the frozen shoulder syndromes? Well, what we now know too is inadequate amounts of B12 can really contribute to that formation. So if we get B12 in there, keep the levels like in a good multiple vitamin, or even adding extra when you are injured, that can help prevent the calcium from forming and get it to reabsorb back into the body. B6. I worked with pro athletes, a few back in Phoenix, and I have to say that this was probably, the fitness trainers recommend always good levels of B6. And before we had a whole lot of choices, this was a while back, they would just take 100 milligrams multiple times a day, but there are some out there now that are like a 500 milligram sustained release. You got to take one a day. That really speeds the healing of chronic tendonitis. And I'll tell you, you can just ask my UPS driver as far as plantar fasciitis, absolutely reduced and sped up the healing. Now, there's something I don't have on here that I put usually right after here, and it's called MSM, and I just brained it out. MSM is a sulfur compound that contributes and aids and abets to vitamin C and sulfur uptake into the tissues to help with the collagen matrix. And usually we're finding between 2,000 to 3,000 milligrams of MSM per day, twice a day, excuse me. So that's 4,000 to 6,000 milligrams a day, really can speed up. And there are some UCLA studies that are underway. One of my customers participated in this for shoulder post-op when they would do shoulder surgeries, and it's phenomenally aiding and abetting the healing and recovery from these shoulder surgeries, which can take 6 months to heal from when you have a rotator cuff injury. Quercetin. Now, oftentimes we use quercetin, at least in our stores, the customers will come in and they'll use it for their allergies. Well, what it does is it limits the release of histamine, hence the allergies. And see, when you limit the histamine and other mediators of inflammation, you're going to limit tissue destruction. So if you have overproduction of histamine, the tissue is going to become more inflamed. So we try to reduce the inflammation, and quercetin is one good way to do it. Clinical studies on bromelain, kind of funny. All my ladies that come in and get their eye jobs done, or their breast enhancements or facelifts, the doctors are recommending, besides Arnica, Montana, Bromelain. There's clinical studies to show it's a reduction of bruising, healing time, and pain following an injury because it is an anti-inflammatory, but you have to have the right kind. So usually 500 to 1,000 milligrams with what's called a high GDU level. That's a measurement, an energy measurement unit that makes it active. On an empty stomach a couple times a day really can reduce the inflammation. Turmeric, anti-inflammatory. I know even Dr. Rosenfeld on Fox News a few weeks back was talking about substitutes for drug anti-inflammatories, and turmeric or turmeric extract, which is also known as curcumin, have an extreme anti-inflammatory response and reduction of inflammation. Serrapeptase enzymes. If you got a chronic issue, I tell you, I had a chronic hip issue with tendonitis in my hip. I did some trail running marathon training, and I tell you, it was causing issues. Stopped it. You know, I did in the right dosage. It just helped eat up the scar tissue, reduce the inflammation, and very helpful. Good multiple vitamins should always include some zinc and some natural vitamin E, which always aids in beds healing. And you know how with plastic surgeries they always recommend vitamin E for scars. Well, guess what? Vitamin E on the inside also helps with scarring and inflammation and healing, along with zinc as well too. Anyway, I hope that's helpful. Any questions, you can always stop by the vitamin herb stores and get copies of these, and we have them on hand. Next, we're going to be moving on to the fitness portion of our show, where I'm going to show you an exercise for plantar fasciitis. Thank you. Hi, welcome to the fitness portion of our show, and I'm going to show you an exercise that was recommended, and we'll get it right here, by the American Academy of Orthopedic Surgeons. And this is a stretch that you should perform when you're seated. And basically what you're going to do is you're going to grab your foot, and we can hopefully get a little bit of a close-up, and I'm going to pull my ankle up and my toes towards the front of my leg here. And I'm going to take my thumb and I'm going to massage down in here. This is for plantar fasciitis. You have a tendon right in here that can get injured. You're going to hold that and rub that for like 10 seconds. Allow it to rest. And the surgeons had recommended that you do this anywhere from 10 to 20 times at a session. So that's going to take you a few minutes. They recommended it doing first thing in the morning, and then whenever you're seated for long periods of time and that can get stiff and tightened, do that massage or right on that plantars, and hopefully maybe that will help. It can help speed healing as well as reduce some pain. Next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano.
And thank you for that intro. Well, this one goes in the categories of everything your doctor may have told you about certain things may be wrong, or at least not exactly helpful. Well, coming out of the American Society of Nephrology's 43rd Annual Meeting and Scientific Exposition came a subject called elderly can blame fractures and falls on low sodium. This was a Dutch study. What they did is they took 5,200 Dutch people at the age of 55 or older and followed them for about 6 years. Now, about 8% of these Dutch individuals had something called hyponatremia, which really means dangerously low sodium levels. This particular group happened to be people which tend to be diabetic or taking especially diuretics, which a lot higher percentage of the people in the U.S. seem to take than the Danish. So, what we discovered was this. Those which had low sodium levels in the blood compared to those that did not have low sodium levels, the low sodium group fell 24% of the time compared to those which had regular sodium, which was 16% of the time. Now here is the kicker. The subjects with hyponatremia, low sodium, had a higher rate of fall during the follow-up, but also keep in mind there was no difference in bone mineral density. There was no difference in osteoporosis rates one way or the other. But the group that fell that had the lowest sodium had 61% higher number of fractures than those that had normal sodium levels. Also, the risk of non-spinal fractures, such as hip fractures, was also significantly higher. It was 39% higher compared to those with normal sodium levels. And overall, now here's something else to take into account, that people with hyponatremia or low sodium levels was this. The relationship between hyponatremia and fracture risk was independent of the increased rate of falls in the low sodium group. The subjects with hyponatremia, low sodium levels, had a 21% increase in the risk of death from any cause during the follow-up for over 6 years. So, is salt a good thing or a bad thing? Well, that's for you to determine. But however, salt being overly low, obviously a very, very, very bad thing. Something for you to consider with your doctor, especially if you're doing diuretics. A 21% increase in death from all causes, not just the 61% increase in fractures, the 39% increase in spinal fractures, regardless of bone density, just because of low sodium, is something worth you investigating with your doctor. All right, now let's go to people with dialysis, so people with chronic kidney disease. Now this is a little interesting side note, and it happens to do with pomegranate juice. All right, this is what they did. Again, from the American Society of Nephrology's 43rd Annual Meeting and Scientific Expo that's in Denver. All right. They followed 101 dialysis patients, gave them either pomegranate juice or a placebo, and they only had them drink it 3 times a week for 1 year. All right. This is what they discovered. This goes up, a good thumbs up for pomegranate juice overall. Laboratories tests showed that patients who drank pomegranate juice experienced reduced inflammation. Remember, these are kidney dialysis patients. And the damage of oxidative stress caused by free radicals was minimized. Furthermore, pomegranate juice drinkers were less likely to be hospitalized due to infections. Now, there's no advertisement for pomegranate juice in here. This is an independent study. It is also revealed that those who drank pomegranate juice also showed an improvement in cardiovascular risk factors, such as reduced blood pressure, improvement in lipid files, and fewer cardiovascular events, such as heart attacks and things like that, suggesting they had better heart health. And the authors of the study also put a note at the bottom of this research. Considering the expected epidemic of chronic kidney disease in the next decade, further clinical trials using pomegranate juice aimed at reducing the high cardiovascular mortality rate of chronic kidney disease patients and the deterioration of end-stage renal disease should be conducted. So, one way or the other, something you may want to consider with your doctor, just 3 drinks of pomegranate juice for an entire year was enough to get pretty significant results. So, something to think about, if not add to your daily, nightly drink. And now, one for vitamin C. Do you realize there's really no good treatment for sepsis? And severe sepsis itself has a 40% mortality rate. Well, ironically, the University of Western Ontario and the Lawson Health Research Institute found one powerful tool to prevent, and what they said, the onset of sepsis and also reverse sepsis. What is this amazing pharmaceutical that's out there? Vitamin C. Possibly one of the first treatments they actually have now for severe sepsis. They said, again, severe sepsis has a high mortality rate, nearly 40%, and currently there is no effective treatment, i.e., except now. Through his research, Dr. Tamil discovered that a single dose or bolus of vitamin C injected early at the time or induction of sepsis prevents the capillary plugging, the clotting that occurs. He also found that a delayed bolus injection of vitamin C can reverse plugging by restoring blood flow of previously plugged capillaries. Something pretty amazing for people that have sepsis. Our research in animals with sepsis found that as early as well as delayed injections of vitamin C improved the chance of survival significantly, explained Dr. Timmel. Furthermore, the beneficial effect of a single injection of vitamin C is long-lasting and prevents capillary plugging for up to 24 hours post-injection. The potential benefit of this treatment is substantial. Vitamin C is cheap, safe, and effective. Previous studies have also shown that it can be injected intravenously into patients with absolutely no side effects. Now keep in mind, we did a research article a little while ago about the number of acutely ill patients being admitted to hospitals that already had scurvy, meaning severe vitamin C deficiency. So obviously, something so simple and so cheap and so abundant can prevent such a life-threatening disorder in infants and the elderly or anybody else with a compromised immune system. Somebody out there is not getting adequate levels of vitamin C. This is a vitamin that could save your life before you even know it. So think about that. All right, now we go to something which is kind of interesting. It's also something in regards to light. A lot of us like to sleep with the night light on or have some sort of dim light in the room. Well, doesn't appear to be too good for mood, or I should say depression. What they discovered was this, and this was on the November 17th, that will be released on November 17th, was the annual meeting of the Society of Neuroscience. Exposure to even dim light at night is enough to cause physical changes in the brain of animals that may be associated with depression. This is the first time researchers found that light at night by itself may actually be linked to changes in the hippocampus. All right, they said even dim light was sufficient enough to provoke depressive-like states in animals. The results are significant because the nighttime light used in the study was not bright, what they call 5 lux, or equivalent of having a television on in a darkened room. And only took about 8 weeks to trigger these depressive symptoms. What they discovered was this. The results showed that animals living in a dim light had significantly reduced density of what's called dendritic spines. These are hair-like growths on the brain cells which are used to send chemical messages from one cell to the other. So dim light actually reduced the body's ability to repair, create new dendritic spikes, and also communicate chemical messages to other parts of the brain, therefore resulting in depression itself. Intriguing. So if you can sleep totally in the dark without being scared, it may actually do something quite significantly to improve your mood. Well, I guess we're reaching the end of our segment, and thank you very much for that.
Thank you very much for joining our show. Do your research, especially since we said vitamin C only about 50 times tonight. Thank you very much.